Hello, friends. This is Akulmach Live. I'm Chandrakant. Today, we want to discuss something very, very important, and the subject is about the patient doctor relationship. What is the new skills that doctors need today in order to be effective doctor? We know that doctor sometimes treated like gods because they can give us life, and they can, you know, bring our patient back from death. So, doctors are very, very important entity in our society, but doctors also need to learn things. So today, this is what we want to discuss, and we have a very distinguished guest joining our panel today. Before we start our discussion, I'd like to tell you, friends, that there is a giveaway. Please stick around till the end of this video, and we will tell you how you can win your free gift. So let's get back to our discussion. Hello, friends. Let me introduce our guest today. He's joining us from London. His name is Dr. Umesh Prabhu, a celebrity of sorts. He has been director of NHS, which is a very prestigious role, for almost 15 years. We are very pleased to have him on our show today. Without further ado, let me present Dr. Prabhu to you.
Good morning, ladies and gentlemen. Good morning, CA. It's a great pleasure and honor to be here. I have heard a lot about you. I have heard about your program a lot. My name is Umesh Prabhu. I was a consultant pediatrician. I developed interest in patient safety after my own mistake, and I have now given more than 300 lectures why doctors make mistakes and how to protect patients. Protecting patients, supporting doctors are the two sides of the same coin. Ours is a noble profession and wonderful profession, and we must always put patient at the heart of everything we do. And if I tell you the statistics, I think it will be frightening. But I want you to remember, vast majority doctors are very good. Doctors are treated like gods. There is a study in London. Every year they do this study. 90% of people trust doctors and nurses. Only 17% trust politicians. With that trust, we have a great responsibility on our shoulder, and we must always put patient at the heart of everything we do. And that is the reason why. At present, in the United States, there may be up to 200,000 people die or suffer due to medical error. And in the United Kingdom, 75,000 patients suffer moderate to severe harm due to medical error. But that is, most of them are preventable, and that is my special interest.
Well, doctor, I fully agree with you. Sometimes a doctor who treats you can be given the status of a god, because between life and death, doctor plays a major role. But I think we forget sometimes that doctor is also a human being, and they are also affected by the emotions, and sometimes anger, all kinds of emotions. So, what is your advice to the fellow professionals, how they should control their emotions?
I think the most important thing is for doctor must stay calm. Always stay calm. It's very difficult. If a surgeon gets emotional, he will make mistake and he can cut the artery and patient can die. So most important to stay calm always. It's not easy because doctors are human beings and doctors have got alcohol problem. Doctors have got substance misuse. Doctors get mental health. Doctors have got personality problem. Because doctors are human beings at the end of the day. My advice to doctors is very simple. Be proud of your profession. It's a noble profession. It's a wonderful profession. Without doctors there and nurses, there won't be any patients. That's the reason why we must make sure we always put patient at the heart of everything we do. COVID has affected a lot of doctors. COVID has affected everyone. I have lost 40 of my friends in UK due to COVID. And because doctors work very hard and they are more exposed to COVID. And that's the reason why my simple advice to doctors is be proud of your noble, wonderful profession.
Certainly, I think that's a very good advice. And usually, doctors are very calm. What I've seen is that you go to any doctor, they are very busy. Also, they have to go to wards, and they have to come to OPD, and then they have to give, all kinds of patients. They have to see, treat them differently. Every patient has a different story to tell. They are very calm. But last 15 days to 20 days, I've seen that even doctors are losing their cool. I think, especially in India, there is so much pressure, which this wretched virus has brought to the medical fraternity, that all the doctors are now losing cool. Would you have any word of wisdom for doctors?
I think important. When going gets tough, tough get going. That is the time where your cool is more important, because it's not just the doctors, it's the patients. When I see the video, here my heart cries. I saw many patients dying because lack of oxygen. So it is not just the doctors, it's the patient. So my advice to doctors is be proud of what you do, because without doctors, there won't be anything at all. Without doctors and nurses. And nurses are also equally important. But most important is take the patient through that journey. Be proud of your noble profession. But important to remember, you are a human being. As Devi Shetty said, nobody is perfect. He was telling the other day, I saw a video. Nobody is perfect. Wife thinks husband is perfect. Husband thinks wife is perfect. None of us are perfect. We are all human beings. And you've got to do your best for the patient. But you must be humble. You must have humility. And most important, you must understand why doctors make mistakes. Because only doctors know why doctors make mistakes. And there are complex reasons. It is not because of bad doctors. I have come across bad doctors. Somebody sexually molesting patient, that's a bad doctor. Doctors drinking alcohol excessively, that's a bad thing. But doctors must stay cool and must be very proud of noble profession and must say, I'm going to do it. And the doctor must know how to take patient through the journey. And doctor also needs doctor skill, communication skill, interpersonal skill, organizational skill, team working. So doctor must be good at everything, and it is almost impossible.
Well, I think you made some very, very important, very powerful words like interpersonal skills, and I know for sure that you're not working with NHS. You're now retired, sorts of, but you're helping the medical staff. You're bringing the doctors, you're hiring doctors, making them ready for future. So would you like to give some inputs on this part of your life where you're helping your fellow professions to be a better successful profession?
Let me tell you statistics. At present, there is 5 to 8 million shortage of healthcare workers, including doctors. It is expected to increase to 18 million by 2030. Throughout the world, there is a shortage of doctors. And with COVID, people have realized the importance of doctors. Brazil has got a lot of problems. America has got a lot of problems. Now India has got problems. So we all need doctors and nurses. What we are doing is we are getting doctors from India and nurses from India, training them in UK and hoping that they will go back to serve India. Being a doctor, being a nurse is serving the humanity. And that is what we are doing. That is what, and I'm enjoying it, because my duty is to pass my knowledge to the future generation. And every doctor must be a very good doctor. If not, patients suffer.
So, Dr. Prabhu, let me ask you: are you running an academy kind of a thing, or just an advisory?
I work with many people. I do my own Zoom training. I do Zoom teaching. So that's the reason why. Even in India, I'm doing some Zoom training in the medical college. How to be a good doctor. Why doctors make mistakes. How to avoid this. For example, medication error is one of the most common cause of harm. And in India, nobody has done a study on it. And that is the reason why. My aim is because one day we'll all be patient. So patient safety is a human rights issue. And we must take interest in patient safety, because when patients suffer, doctors suffer. When doctors suffer, patients suffer. And that is the reason why I'm now spending a lot of my time training doctors on how to prevent harm to patients. And in the UK, regulation is very strict. Each year, 9,000 doctors are referred to General Medical Council. And overseas doctors are 6 times more likely to be referred. And reasons are very complex. And that is the reason why prevention is better than cure. I teach these doctors before they come from India what makes you referral to GMC and how to prevent it.
I think this is very, very powerful advice or input or knowledge. I think whatever you want to call it, you can call it. And it is required because the regulations are now getting very tightened all over the world, including in India, where the proper legal bindings are being, issued right now. And while you also mentioned there is going to be dearth of doctors, so that means we need more trained professionals who can not only treat patient but also treat them effectively. And that is where your knowledge comes in, where you tell your fellow professionals to treat the patient effectively. And that is why your knowledge and your courses are very valuable for everyone. Every doctor must talk to you and attend your class.
Let me tell you one important story. Last 3 years ago, a doctor from Chennai in UK took his own life. He was falsely accused of sexually molesting patients. And what a human tragedy. So doctors must know these regulations, what to do when there's an allegation of sexual molestation and how to prevent it. That is what I'm spending time, because prevention is better than cure. And let me tell you, in United Kingdom, 40 doctors have taken their own life, 300 nurses have taken their own life, and vast majority of them are overseas trained doctors and nurses. What a human tragedy. So all I'm doing is prevent these tragedies for anybody, because when somebody takes his own life, his family suffers, his children suffer. And that is the reason why. With COVID also, prevention is always better than cure. So doctors must take interest in patient safety. And in India, violence against doctors is increasing. It's a pretty bad story. I've collected 100 incidents where doctors have been manhandled. And that is what doctors must take interest in these things. Doctors must work with the politicians, and doctors must always put patients at the heart, and doctors must prevent harm to patients. Hospital-acquired infection, medication error, post-surgical complications. These are all very common. And statistics is very worrying. United States, as I told you, 200,000 patients suffer moderate to severe harm. In UK, 75,000 patients suffer moderate to severe harm. And so doctors must take interest in patient safety. Doctors must be very proud of their noble and wonderful profession.
Absolutely, Dr. Umesh. I think you have given a lot of information today, and I think every doctor who wants to become a really good doctor must listen to you. Whether you are in India or Taiwan or Singapore or UK, wherever you are, I think doctor profession as a profession is a universal profession. Um, you can treat any citizen of any country, and that is why they must listen to you, they must engage with you, and they must learn from your experience, because I think you have already spent so many years, more than 30, 35 years in this profession.
I'm very proud of our profession. Ours is a noble profession and wonderful profession. And India is a noble country. India is a wonderful country. We must be very proud of Indian values. It's Indian values, Indian teaching, which made me successful in UK. I'm very proud of India. I'm very proud of United Kingdom. And with Brexit, there is a very good opportunity for both the countries to grow together, learn from each other. And that is what my dream is, so that India and UK both can be a great two nations and work together. Boris Johnson has already said he wants to do trade deal with India, and I think Narendra Modi. And now India is suffering, and we are all helping India, and we are praying for India. Hopefully, both the countries will grow together and become more successful in the world.
Well, doctor, you mentioned about the trade deal. So a part of a trade deal came out 2 days back, where there is a bilateral agreement between UK and India, and the value of the agreement is about 1 billion pounds, or 1.4 billion US dollars. And because of this agreement, there will be 6 to 7 thousand new jobs in UK, and UK is going to help Serum Institute to develop AstraZeneca and other vaccination, even the nasal vaccination. So I think this is the precursor of the free trade deal, which is going to happen in few days from now. So I think eagerly waiting for that to happen.
I think that's a very good. And not only that, UK can learn from India, because India makes medicine very, very cheap rate. In UK, medicines are very, very costly. So there are a lot of things. And if you look at India, India spends, for example, Narayana Hrudayalaya, I think they do a lot of, very highly efficient elective operations. So UK can learn from India, India can learn from UK, and both of us can grow together.
Absolutely, doctor. It was a pleasure talking to you and learning that how you're keeping yourself busy now. You're helping other doctors and medical staff world over to be a better professional, better doctor. I think it's a pleasure for the years to learn from you. But this is not the last discussion we had. We will actually invite you again next week and discuss something even more interesting.
Thank you very much. I really appreciate it. You're doing a fantastic job. I know you know Neha. I know you know Neville. They are all my friends. I think most important is When you are very proud of your profession, make sure your professional integrity is maintained. And I want to help the doctors so that neither the patients suffer nor the doctors suffer, and we can have a fantastic, be proud of this noble and wonderful profession.
Thank you, doctor. So I say goodbye for today, only to meet you next time.
Thank you very much, and it's a great pleasure to have you. And great, you're doing a fantastic job. Keep up your great work. Okay.
We have some unique Akulmach memorabilia which will make you look outstanding. The graphics on these corporate gifts are based on the global best business practices. To become recipient of one of these gifts for free, you have to watch this video till the end and provide your valuable comments. Or you can also share your experiences. The person who makes the best comment would be chosen to become a recipient of these beautiful Akulmach gift, absolutely free, delivered to your doorsteps. The winner would also get a chance to be invited live as a distinguished panelist during our next video. What are you waiting for, friends? Please subscribe Akulmach and smash that like button.